Something huge just came out of the Oval Office, a policy shift on marijuana that's been talked about for decades. In this explainer, we're going to break down exactly what this rescheduling means, why it's happening right now, and what's coming next. And there you have it, straight from the source. This isn't just some minor regulatory tweak, oh no. This is a fundamental reclassification of a substance that's been locked in the most restrictive category of federal law for more than half a century. So what on earth does that actually mean? Okay, to really get what a big deal this is, you first have to understand what these schedules even are. This isn't just about paperwork. It's about changing the entire federal definition of marijuana, taking it from a drug with officially no medical use to one with accepted medical potential. I mean, just look at the difference here. It's night and day. As a Schedule I drug, marijuana was in the same legal bucket as heroin and LSD. The government's official line was high potential for abuse and, this is the key part, no currently accepted medical use. Moving to Schedule III puts it in the company of things like Tylenol with codeine. These are substances that are recognized as having a real medical purpose, even if they still have some potential for dependence. That right there, that's the whole ballgame.
So it all comes down to that one phrase in the new definition. The U.S. federal government is now, for the first time, officially saying that marijuana has a currently accepted medical use in treatment. This one little change in status, it's the key that unlocks pretty much everything else we're about to talk about, from how patients get care to how scientists can even study it.
So why now? What was the big push? Well, according to the White House, this wasn't just some abstract policy debate. It was driven by immense pressure from patients, their families, and their advocates. The president said he got more calls on this than almost any other issue, from people literally begging for me to do this. And we're not talking about minor aches and pains here. The conditions that were cited as the driving force behind this are just devastating. The announcement specifically called out Americans dealing with extreme pain, incurable diseases, aggressive cancers, and severe seizure disorders, things that absolutely wreck a person's quality of life. And veterans were a huge focus of this announcement. Dan Willey, the national commander of the American Legion, was actually right there at the signing. He stressed how critical this step is for vets who are dealing with PTSD, depression, and chronic pain from their service. He believes this could, and I'm quoting him here, open up a whole new method of treatment. And, they didn't present this as some big, controversial move. Far from it. The administration pointed to polling that suggests, get this, 82% of the public supports this reclassification. They framed it as simply reflecting what the vast majority of people already believe is just common sense. But as big as the patient side of this is, many experts are saying the really profound long-term impact, that's going to be on medical science. Because for decades, cannabis research has been trapped in this legal stranglehold. You had researchers like Dr. David Kostra putting it bluntly. He said that its Schedule I status created this massive wall, making it really, really, really difficult to do the kind of big, serious studies you need to truly understand what a substance does, the good and the bad. So what's actually going to change for scientists? Well, a few big things. First, research is going to be democratized. More universities and research centers can finally get in the game. Second, scientists will get access to better, more reliable, and standardized products to study, which is crucial for good data. And third, and you guys, this is a big one, it means we can finally have large-scale clinical trials studying hundreds of thousands of patients, not just a few dozen. And at the end of the day, as Dr. Alana Brown explained, it all comes back to the patient. This isn't just about scientists publishing papers. It's about being able to finally ask the hard questions about dosing, about safety, and figure out who could benefit the most. It's about helping people not just live longer, but actually live better. Okay, now we need to talk about a really, really important point here, because the administration went to great lengths to draw a very hard line in the sand. The president's own words could not have been clearer. He said it over and over again. This executive order is not legalization. It, quote, doesn't legalize marijuana in any way, shape, or form. This was a purely medical reclassification, and they were absolutely adamant about that. So you can really see the split here, right? On one side, you have medical use for specific conditions, guided by a doctor. That's what this order is all about. On the other side, you have recreational use, which is not being sanctioned at all. One is in, the other is explicitly out. So the ink is dry on the order. What happens now? What are the actual practical steps that are going to follow? This wasn't just about changing a word in a law. It was also about launching some brand new initiatives. All right, so here's what's next. First up is a new model from the Centers for Medicare and Medicaid Services, CMS. It's designed to give seniors access to products with CBD. That's the non-psychoactive part of the plant. If a doctor recommends it, eligible seniors could get these products at no charge. And here's the crucial part. CMS is going to collect a ton of data on how it's working for people, creating this massive new database for researchers. The administration also gave Congress a nudge to take another look at the rules for CBD that comes from hemp. And just to put a real number on that Medicare plan for you, this new model, which could start as soon as next April, would allow eligible patients to receive up to $500 worth of these products every year. So this isn't just an idea, it's a practical program with a real budget. So there you have it, a landmark decision pushed by patient stories and apparently backed by the vast majority of the public. But maybe the biggest story here is the one that hasn't even been written yet. For the first time in generations, the door to real, serious, large-scale medical research on cannabis is finally swinging open. The real question now is, what are we going to find?